There's a moment a lot of people never talk about. You're sitting in a chair and you go to stand up, and your hand shoots out for the armrest before your brain even decides to move it there. Automatic. Instinct. You don't plan it. Your body just knows it needs the help. Or maybe it's the top of the stairs. You pause half a second longer than you used to, one hand already reaching for the rail, bracing before that first step down. Maybe it's even smaller than that, getting out of the car and feeling that first stiff twinge before you've taken a single step. If any of that sounds like you, I want you to really hear this. Your knees have already been talking to you. Most people just don't realize it until the pain gets loud enough to stop them completely. And by the time it's loud, most people reach for exactly the wrong fix. My name is Dr. Ryan Cole. I'm a physician who works with older adults on leg strength, balance, and staying steady on their feet. And today I'm not giving you another random list of exercises to try once and forget by Thursday. I'm giving you an actual routine, 15 minutes, start to finish, in order, with a clear reason behind every single piece of it. Because here's what years of this work have taught me. Most people with knee pain aren't lazy, and they're not doing nothing. They're doing something, just the wrong something in the wrong order, with no real structure holding it together. That missing structure is the piece nobody ever hands them, and it's the piece that changes everything once it's in place. So stay with me, because by the end you'll know the exact sequence, a simple way to check where your knees actually stand right now, what to do when pain flares up out of nowhere, and how to know for certain, not by guessing, that it's working. But first, you need to see exactly why the thing you've probably already tried has been working against you. Let's get into it. Here's a mistake I see constantly. Someone's knee starts hurting, and they swing to one extreme or the other. Either they stop moving almost entirely, hoping stillness will let it settle, or they push through with the same routines they've always done, assuming more effort simply means more healing. Both quietly make things worse, just on different timelines. Too much rest lets the muscles around the knee go soft and weak, so the joint ends up absorbing more of your body weight with every single step you take, every single day. Too much of the wrong kind of movement, deep bending, twisting, hard impact on a hard surface, grinds down tissue that doesn't repair itself quickly, or easily, or sometimes fully at all. I think of it a bit like a door hinge. Leave a hinge completely still for months and it seizes up, stiff and creaky. But force that same hinge open and shut too hard, too often, under too much weight, and it wears down faster than it should. What a hinge actually needs is regular, smooth motion without excess strain. Your knee isn't so different. The fix was never more or less. It's the right kind, at the right dose, done consistently. That's what a real routine gives you, and a scattered list of exercises never can. And once you understand what's actually happening inside that joint, you'll never look at just rest it the same way again. Let me explain this simply, because understanding why something works is what makes people actually stick with it. And I've seen that understanding be the difference between someone who quits after 4 days and someone who's still doing this a year later. Picture your knee joint like an engine that needs oil circulating through it to run smooth. That oil inside your knee is a fluid that lubricates the joint and feeds the cartilage, the smooth cushioning tissue sitting between your bones, the part that lets your bones glide instead of grinding against each other. Here's the catch, though. That fluid doesn't move on its own. It only circulates when the joint does. Sit still too long and it pools, and that cushioning gets starved of what it needs to stay healthy. Move gently and regularly, and the fluid circulates, delivering nourishment exactly where it's needed most. At the same time, the muscles around your knee, especially the ones running along the front and back of your thigh, act as a support crew. Physical therapists often describe strong thigh muscles as the difference between a knee that shares the load and a knee that's carrying it all alone. Strong muscles absorb a real share of the weight with every step you take. Weak ones hand the joint the full bill, step after step, day after day, which is exactly why the pain often gets worse the longer someone avoids moving. There's one more piece worth understanding: balance between the front and back of the thigh. Many people, without realizing it, build strength unevenly, favoring one side of the leg and neglecting the other. When that happens, the knee absorbs uneven pressure with every stride, like a table with one leg slightly shorter than the rest. That's part of why a real routine works through the whole leg, front and back, not just one muscle group in isolation. That's really the whole story. Nourish the joint through gentle movement. Support it evenly with stronger muscles around it. That combination is what lets a knee feel better over time, not overnight, but steadily, and often more than people expect. But there's a question sitting underneath all of this that I need to answer before you commit to a single rep. I want to answer this directly because I hear the question constantly, and it rarely gets answered honestly. If you're 70, 75, even older, and if you've already been told you have wear and tear, or arthritis, or you've carried this pain for years, you might assume the window has closed, that this kind of routine simply isn't for you anymore, that it's meant for someone younger, someone earlier in the process. It hasn't closed. Research on older adults shows again and again that joints and muscles keep responding to movement at any age. Muscle can still be rebuilt well into your 80s and beyond, and joint tissue still benefits from the right kind of motion, no matter how many years you've had it. That doesn't mean every ache vanishes, and I won't stand here and promise you a cure. That wouldn't be honest, and you deserve honesty more than you deserve a nice-sounding promise. What I can tell you is this: many people notice real improvement in comfort, strength, and confidence once they start moving the right way, consistently, no matter their starting point, no matter their age. And if you've already been told you'll need a knee replacement someday, or you're managing arthritis right now, this routine isn't here to replace your doctor's plan, and it's not a shortcut around it either. Think of it as walking alongside that plan, keeping the muscles around the joint as strong as they can possibly be, either way, whatever path your knee eventually takes. Before the routine itself, I want to give you one simple way to know your real starting point. Not a guess, not a feeling, an actual number. This takes 30 seconds, and it's the difference between hoping this is working and knowing it. Sit in a sturdy chair with armrests. Cross your arms over your chest, no hands allowed, and try to stand fully upright, then sit back down. Count how many times you can do that in 30 seconds. There's no pass or fail here. This isn't a test to dread, and it isn't a competition with anyone else watching this video. It's just a baseline, a number that belongs only to you, that reflects only where you are today. Hold on to it, even just in your memory, or better yet, write it down somewhere you'll actually see it again. In 2 to 3 weeks, once you've done the routine consistently, try it again. Most people watch that number climb, and that's not a feeling, that's proof, something concrete you can point to on a day when you're wondering if any of this is actually doing anything. One more thing before we go further, because I'd rather slow down for 10 seconds now than have you regret skipping this. If you have significant swelling, a recent injury, a heart condition, or you've had recent surgery, check with your doctor before starting anything new. This routine is built to be gentle, but your own situation always comes first, every time, no exceptions. Here's the routine itself. No equipment needed. Every single movement can be done seated if standing is hard for you, or if today just isn't a standing kind of day. Do it once daily, 15 minutes, start to finish. Less time than it takes to watch a sitcom rerun, for something that could change how you move for years. Step 1. The wake-up hold. Sit tall in a chair or lie on your back if that's easier. Straighten one leg fully and gently tighten the muscle on top of your thigh, pressing the back of your knee down like you're flattening it into the surface beneath you. Hold 5 to 8 seconds, then release. 10 times on one leg, then switch. This is how you wake up and strengthen the thigh muscle without putting a single ounce of bending stress on the joint. It's the safest possible starting point, and it builds exactly the support system we just talked about, the muscle that carries the load instead of leaving your knee to carry it alone. If you're stiff first thing in the morning, This is the gentlest way in, and many people find it useful to do a few of these right when they wake up, even before getting out of bed. Think of it as switching the engine on before you ask it to do any real work. And once that engine's warm, it's ready for the piece most people skip entirely, the hip. Step 2. The gentle lift. Still seated or lying down with one knee bent and the other leg straight, slowly lift the straight leg just a few inches off the ground. Hold briefly at the top, then lower it slowly, about 3 seconds down. 10 reps, then switch legs. This one brings the hip into the picture, not just the knee. Stronger hip and thigh muscles even out the way you walk, which pulls pressure off the knee joint itself with every stride you take outside this 15 minutes. Think of it like steadying a wobbly table leg. Once that support is solid, everything resting above it moves smoother and stays that way, even under load. Step 3. The supported half bend. Stand behind a sturdy chair or counter, holding on for balance, feet about hip width apart. Bend your knees just a small amount, nowhere close to sitting, just enough to feel your thighs engage, as if you're about to sit down and change your mind halfway. Hold for a second. Rise back up slowly. 8 to 10 reps. If standing isn't your day, do a smaller version seated. Rise partway out of the chair using your legs, then lower back down with control, no hands. This is exactly where people go wrong trying to strengthen their legs on their own. Bending too far, too fast, and slamming pressure straight through the joint, often trying to imitate exercises meant for someone decades younger. Staying shallow and controlled builds real strength in the front and back of the leg without asking the knee to absorb weight it isn't ready for. And that shallow range is genuinely enough to make a difference. Now we flip to the side of the leg almost nobody trains, and it's the one that keeps you upright. Step 4. The balance and strength combo. Hold the back of a chair or a counter for support. Shift your weight gently onto one leg and slowly bend the other knee behind you, bringing your heel a short distance up, controlled, not far. Hold 2 to 3 seconds, lower slowly. 8 reps per leg. This one does double duty. It works the back of your thigh, balancing out everything you just built in the front, closing that uneven gap we talked about earlier. And because you're briefly balancing on one leg, it trains something just as important as strength, your stability, which matters enormously when it comes to staying upright on uneven ground, wet pavement, or an unexpected curb. If balance is a real worry for you, keep both hands on support the whole time, and lift only a small amount. There's no rush here, ever, and no one's timing you. Step 5. The bridge. Lie on your back, knees bent, feet flat on the floor. Lift your hips a small distance up, gently squeezing through your seat muscles, then lower with control. 10 reps. This might be the single most valuable move in the entire routine, because it shifts real work away from the knee joint and hands it to the stronger muscles of your hips and core, muscles that are built to carry heavy load far better than a joint ever was. The stronger those become, the less your knee has to compensate every time you stand up, walk, or climb a flight of stairs. If getting down to the floor is difficult, modify it seated. Press your feet into the ground and gently lift your hips slightly off the chair instead. You'll still get real benefit from the seated version. Don't skip it just because it's not the floor version. That's the full routine. 5 steps, 15 minutes. Every one of them adaptable to a chair if that's what today calls for. No gym, no equipment, no one watching but you. But knowing the moves is only half the picture. Knowing what's normal and what's a red flag is the half that actually keeps you safe. I want to be completely clear here because this matters more than almost anything else in this video, and it's the part I'd hate for you to skip past. A little muscle fatigue, mild warmth, or a slight ache during or shortly after these movements, that's normal. That's simply muscle working, waking up after being underused, and it should ease within a day. But sharp pain, pain that worsens as you move, sudden swelling, or pain that lingers and builds over the following days, that's your body telling you to stop and call your doctor. Never push through that signal hoping it'll pass on its own. Gentle and consistent beats hard and painful, every single time, without exception. Some days will be harder than others. That's simply the nature of ongoing joint pain. And it doesn't mean you've failed, and it doesn't mean the routine has stopped working. On those days, don't skip the routine. Shrink it. Half the reps, a smaller range of motion, gentler through every step. A little circulation on a hard day still beats none at all, as long as you stay inside that comfortable range we just talked about. This was never about perfection. It's about consistency, even in its smallest form, especially on the days it feels hardest to show up for. After 2 to 3 weeks of doing this daily, most people find the movements starting to feel noticeably easier. That's your signal to progress, not by rushing into anything intense, but by adding a few more reps to each step, or holding each position a second or two longer. Try the chair stand check again around this point. If that number has climbed, that's real, measurable proof the muscles supporting your knee are getting stronger. Let your own numbers set your pace, not a calendar, and not comparison to anyone else. Some people progress in 2 weeks, others take longer, especially if they're managing arthritis or coming back from a long stretch of inactivity. Both are completely fine, and neither one means you're doing this wrong. What matters far more than speed is that the direction keeps moving forward, however slowly. A knee that's a little stronger this month than last month is a knee heading somewhere good. So here's the full picture. Your knee pain isn't a life sentence, and it was never going to respond to only rest or only pushing harder. It responds to the right movement, done consistently, in the right order, nourishing the joint, strengthening what surrounds it evenly, giving your body the support it's been quietly missing, maybe for longer than you'd like to admit. I think often about a woman I worked with in her early 70s, a retired teacher, who told me she'd quietly stopped taking her evening walks because she dreaded the stiffness that followed. She wasn't in bad shape, she just never had a clear plan. So without really deciding to, she'd stop doing something she loved. The way these things tend to happen slowly, one skipped walk at a time, until one day it's just not part of her life anymore. Once she had an actual structure to follow, something simple she could measure and build on week by week, her walks came back. Not overnight. One small, steady step at a time. That's really the whole point of a routine like this, not a dramatic transformation by tomorrow morning, but quietly getting back the things pain had taken from you, without you even fully noticing they were gone. I'd genuinely love to know where you're starting from. Leave your chair stand number in the comments, and tell me whether you're doing this seated or standing today. If knee pain has been part of your life for a while now, share your story. I read every one, and it helps me understand what to cover next. And if there's one thing you miss because of your knees, a walk, a garden, chasing a grandchild across a yard, a simple trip up the stairs without thinking twice, tell me that too. It helps me know exactly what to bring you next, and honestly, it's often the reason someone else in the comments decides to start. If someone in your life has been quietly avoiding the stairs or reaching for furniture just to stand, send them this video. It might be the structure they've been missing all along, and it might be the nudge they've been waiting for without knowing it. Your legs carry you through every day of your life, to the mailbox, up the stairs, out the door for a walk, toward the people you love most. Protecting that was never about becoming an athlete again. It's about standing up without a second thought, walking without hesitation, and staying steady on your own 2 feet for as long as you possibly can. I'm Dr. Ryan Cole, and this has been Senior Leg Health. Keep moving, keep building, and I'll see you in the next one.